pressure is quite common in pregnancy. How common? Pretty common that approximately 1 in 10 women will have at least one or more episodes of elevated blood pressure before her delivery. But the majority of these are benign, meaning they are not associated with adverse outcomes and don't need medical intervention. However, 1/3 of women who do go into these episodes of elevated blood pressure will develop a condition called preeclampsia, which is a leading cause of maternal death around the world. According to the World Health Organization, about 50,000 to 75,000 women die of this condition each year. It also leads to several other complications that affect both the growing fetus and the pregnant mother, which is discussed in detail in my dedicated video about preeclampsia. So how can we classify hypertension during pregnancy? It's quite easy. First, we have to decide whether the mother already had hypertension before she got pregnant, or did she develop hypertension as a result of her pregnancy. And for this, we use the 20th week as a general cutoff point. Meaning, if the mother already had hypertension before 20 weeks, it is considered as chronic hypertension, in which case the hypertension will persist even 6 weeks after delivery, which validates the fact that her hypertension was not an effect of her pregnancy. On the other hand, if the mother develops high blood pressure after 20th week of pregnancy, it is most likely an effect of her pregnancy. And in most cases, the hypertension will resolve by 6 weeks postpartum. This is called gestational hypertension. And this can either be with or without proteinuria, meaning elevated blood pressure without protein in the urine, in which case we call it non-proteinuric PIH or pregnancy-induced hypertension. And when they develop proteinuria together with hypertension, which is the case in 1/3 of these patients, we simply call it preeclampsia. Okay, so we have got the basic classification sorted, which is chronic hypertension, gestational hypertension, and from that, 1/3 preeclampsia. But can a patient with chronic hypertension develop proteinuria after getting pregnant? Yes, indeed, they can. And this is called superimposed preeclampsia. And this is very detrimental to both the fetus and the mother. But even without superimposed preeclampsia, chronic hypertension itself can be dangerous and is associated with a multitude of fetal and maternal complications. This is important because during pregnancy, there is a decrease in blood pressure due to peripheral vasodilation. This is a physiological process that happens in all pregnancies, and this process can mask any underlying chronic hypertension. As an example, if Mary's blood pressure at 12 weeks of pregnancy was measured at 135/85 mercury millimeters, although within normal limits, it should raise suspicion of an underlying hypertensive tendency. Now that you know the various types of hypertensive disorders in pregnancy and why it is important to identify them early on, learn more about what signs and symptoms to expect, how to properly diagnose and effectively manage any complication related to hypertension during pregnancy in my in-depth tutorial about preeclampsia. As always,
here is a sample question. Answer and don't forget to type the letter of your chosen. Answer in the comment section. Are you ready? A 30-year-old woman at 34 weeks gestation comes to the clinic for a prenatal visit. Her BP has been consistently around 145/95 mmHg since before pregnancy and is controlled with medication. Her BP is 160/105 mmHg. And urinalysis shows 2 protein. She complains of persistent headache and blurred vision, which is the most accurate diagnosis. A preeclampsia, B. Gestational hypertension, C. Chronic hypertension, D. Superimposed. Type your answer in the comment section. I have a magic spell to expedite the license click. The 3 signs that you will see it could be the heart plus arrow equals Licensed for the board exam, many were. Regretful after not listening to. The which you will see. How a ha 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 ha.